Welcome, everyone, and thank you for joining us today. We'll get started in just about a minute or so, just to give everyone a chance to hop on. Uh, right. So, as you can see on your screen, uh, we gonna talk about agentic AI in healthcare, and more of it, the impact that we are already seeing, and not just the potential it has in the space of healthcare. So I'll just allow one more. Okay. So before we dive in, I would like to extend a special thank you to AWS and to Jonathan for partnering with us on this session. Starting with a quick introduction, I'm Vikas from Factspan, where I lead our AI analytics practice. For the last 10 years, I worked with healthcare clients, life sciences, and pharma clients to move some of the projects in the space of AI, ML, analytics, and now providing consulting in the space of generative AI for them. With me today, we have Jonathan from AWS. So, Jonathan, would you quickly introduce yourself too for us to just kick in?
Yeah, thank you, Vikas. So I'm Jonathan. I'm a partner solutions architect here at AWS, and we really just work with partners to be able to accelerate their growth through the APN journey. And our team does this through various co-building, co-marketing, and co-selling opportunities. Excited to be here today and enjoy the webinar. Thank you, Vikas.
Thanks, Jonathan. So now let's look at how we'll spend our next 1 hour or so, right? So we'll start by grounding ourselves in the challenges healthcare is facing, and how agentic AI is the right answer for that to solve now. We'll understand from AWS side what are the services or the foundation that makes that possible. From there on, I'll cover some of the solutions or accelerators that we are building with our clients. What are some of the offerings that we have in that space? I'll also showcase a quick live demo, and then cover some of the points on reliability. How do we see the ROI? What are the safety measures that we should look into while working or building the agents? And then finally, we'll wrap up with some of the questions that you might be having while we go over this webinar. So now again, for me to talk about the solution, we can just pause a little over here and on this slide and look at the challenges that we all know, right, in the space of healthcare. On the operation side, we all know that teams spend a good amount of time on the processes that are out there, right? Just take an example of prior authorizations. There are some of the workflows in the space of intake and the intake of the patients, the discharge, where they create some of the notes. There are always claim denials that are happening, which the compliance team keeps solving it. For the clinicians, they are already burdened by the documentation, the inconsistent handoffs, the context which is getting lost across the systems, and then you have IT and platform team who need to solve the problems where the data is siloed enough. There's always issues on integrations where you have multiple integration related works getting piled up. There is audit pressure from the governance team to look into all these integrations that IT team needs to look into. And for the research team, there's the progress that they want to do at a faster pace is already being slowed down by the manual evidence collation that they do, repetitive experiment loops that they have to solve into, right? So all these challenges have been not these are not new, right? These we have tried addressing them with different ways of technology, right? But the reality is that all these solutions have only touched the surface. And just talking about the technology wave, right? I mean, you have seen the RPA side of the world, where there was already the big automations that happened, something like form filling, all that repetitive task of form filling was automated a bit using RPA systems. Then for the last 2 3 years, we have generative AI being helping around solving some of the workflows in the space of summarization, in the space of content creation. And now we are entering into an era of agentic AI from last 6 to 8 months, right? Where agents just don't generate the content. They have a way to plan multi-step tasks. They have a way to call the tools, the APIs, and also track that context with memory, right? And always ensuring that there is a human who stay in the loop for the key checkpoints of the workflow. For the healthcare, that becomes much more important because this entire industry runs on the workflows, right? Be it translating or assisting the intake processes, the document copilot that we can leverage for the compliance aware automation, where we can bring in agentic flavor to it, right? For accelerating research, you always have a way to leverage the agents. Now, all this is not possible without having a strong foundation, and that's where the services that AWS offers come in. And I would like to have point of view from Jonathan as well on that, on what are some of the services that AWS offers to build a strong foundation for us to leverage agentic AI in this entire workflow for the healthcare systems. Jonathan, if you can, I can just request you to share your point of view on this.
Yeah, for sure. So at the core of it is Amazon Bedrock, which provides secure access to foundational models in a fully managed manner. Beyond just the model access, though, AWS has introduced Bedrock agents and Agent Core. And this infrastructure just really makes agentic AI production ready. So with Agent Core runtime, agents can run long sessions up to 8 hours, and you're able to scale and accelerate the time to market while providing a secure workload isolation. With Agent Core memory, this provides persistence, so agents remember the conversations throughout sessions, and this just prevents repetitive questioning and keeps context consistent, simplifying the memory management process. So this provides enterprise-grade storage while enabling deep customization, handling both short-term and long-term memory. After this, we have Agent Core Gateway, and this makes it really simple to connect enterprise systems and securely expose them as tools to agents. It offers a simplified tool integration and provides a secure unified access. In addition to the semantic search capabilities, this dramatically reduces integration time. Agent Core Identity ensures that both users and agents have fine-grained authorized access. And finally, AWS provides guardrails and Agent Core observability. So guardrails enforces the compliance boundaries, while Agent Core observability tracks latency, token usages, and etc. So these can also integrate with CloudWatch and other tools, and AWS just kind of provides the infrastructure for all of this. AWS doesn't just provide AI models, but also invested in making AWS the best place to build and deploy the most trusted and performant agents in the world. For this next slide, I just want to talk a little bit more about the top generative AI healthcare use cases. And a lot of it we see like span 5 key domains. So first off, we have clinical workflows. So some of the use cases we see is such as like enabling like ambient listening during patient encounters and automating clinical documentation and note summarization. In terms of care management, we've seen partners streamline registry management and perform risk analysis at both the patient and population levels. In terms of patient engagement, we've seen self-service care triage solutions, and we've seen personalized care guidance. This really just creates easy to understand patient reports and just helps on that front. In terms of education and research, partners have enhanced clinical trial patient matching, and they've also streamlined research publication summaries. Lastly, IT and enterprise operations are pretty obvious, but a lot of partners have powered self-service enterprise Q&A chatbots, and they really support medical reference inquiries and other automated processes. So these capabilities really just demonstrate how AWS's generative AI solutions are transforming healthcare delivery across the entire care continuum. So in addition, I just want to briefly mention, we've also seen specific agentic AI use cases in healthcare and life sciences. From a life care focus, there's like biomarker discoveries, leveraging large molecular databases, and like clinical trial protocol development optimizations. And for the healthcare delivery, we've seen clinical workflow automation to handle these unstructured medical data and a lot of like patient and like member engagement with personalized communications. So I know that's quite a bit at once, but Vikas, I just want to bring it back to you. Now that we've given some context about the foundations, can you just kind of show us how this can come to life in actual healthcare workflows?
Yeah, for sure. And thanks, Jonathan. I think that was a great overview of how AWS provides that secure and scalable foundation, right? Specifically for agentic AI. And I think you acknowledge the same what we are seeing across these areas of clinical workflows, patient engagement, and all. So let me just walk everyone through the 4 production-ready use cases we are deploying with some of our key clients. I have just picked up these use cases from the angle of agentic AI. There are a lot more that we are doing in the space of generative AI as well, but specifically for today's discussion, I just wanted to bring up these use cases. Now, starting with the first one, right, the note summarization. Now, this can be both for intake and for the discharge note summary, right? So typically, what happens is nurses spend a lot of time turning that messy inputs that they get from the patients into a clean note, right? They need to reconcile multiple levels of information that's out there in the documents which patient shares. All the reconciliation happens right now manually. Even if they have some technology for scribing it, that also is messy because of the transcription that happens. Now, with Bedrock agents plus the guardrails, what we have done is we have safely helped our clients summarize it, normalize those terms, and then also capture the right medical entities for the right fields getting summarized. We already have a Flux Healthcare Copilot. We have pre-built EHR connectors that go into that Flux Healthcare. There are set of safe prompt patterns that we have developed over the period, which is out there available for any of our new clients, and which can right now accelerate their time to development. Uh, Outcome in terms of outcome, we typically have seen around 20 to 40% of less documentation time, and has reduced the entire process of reworking on these scenes, right? Second, PBM optimization agent. Now, this is from the side of payer and pharmacy side, right? Where multiple headaches are there on the claim rejects and the formulary confusion that arises because of the new policies that keep get adding. We leveraged Bedrock with vector search so that agents can just retrieve the right set of information that right now is in unstructured format. Right now, it can be in your coverage, it can be in your policies document. How do we get the right context? On top of that, we have our RAG framework, which makes that entire process easier. There are a set of frameworks that were built to retrieve the right information, to process or parse the unstructured data that's out there. Third one is EHR analytics, right? Now, this is important for clinicians and analysts who want to quickly get an answers that are out there in EHR systems. Now, traditionally, obviously, this information is there in the SQL database, but how can clinicians get that information not depending on the analyst or data analyst, right? So they have a way to do query it in a natural language and then get that information back from the traditional DB in a form that it can be understood by them, right? That how can our NLQ platform interpret the right intent? Again, ensuring that it's compliant enough, and then providing it back to the clinicians so that they understand in their language. Finally, the fourth one is around MLR process. It's MLR review agent that we have for our pharma client. Now, for in the space of life sciences, that process is basically known as medical legal regulatory review, right? Because what happens is for any of the promotional activities that pharma or life sciences needs to do has to be vetted through multiple systems or multiple business units, from marketing team, from medical team, legal team, and then regulatory, right? So all that involves a bit of orchestration, getting streamlined, right? So you have to orchestrate all that information across all these BUs. And that's where we have our agentic orchestration engine, which basically does that entire handoff between one BU to another BU, transforms that information back. We have seen that this process been cutting down nearly half of the time that it was right now taken by the human people. Right now, with agents, it has reduced to 50% of the time. Now, what I can do is I can quickly run through a quick demo of all these agents that we have out there, and for that, I'll just start sharing my screen and I'll pull up Flux Healthcare. So let me just do that quickly. Right, there you go. So you have the screen, right, where I've just pulled up the Flusk Healthcare, which has around five pre-built co-pilots available for our clientele in the space of pharmacy and healthcare. Starting with the pharmacy call note summarization. Now, let me just talk about the real problem here, right? So the problem that the clinical team faces right now is around this the part where they need to address some of the grievances that patients may have. They need to address the adverse event they might be getting, the to and fro communication that happens with the patients, and suddenly if a clinical support team is addressing that event or that grievance, they need to go into multiple system to understand what exactly happened with the patient. Was when did the refill get run away, what exactly the prescription has been given to this patient. Now all that information is siloed enough, right? And for a clinical support team to gather that information quickly, we have created an AI solution that can summarize that entire backlog of events that have happened with the patient. Let me just show you with an example, right? So here I have uploaded all that bunch of interactions that have happened with the patients from the pharmacy team, and the moment I trigger it, you see a bunch of agents getting executed, where they are trying to extract the event. They're trying to build a week wise summary out, and then also verifying whether that information is compliant enough or not before you get a summary out of it, right? So all these agents work one by one to provide a summary, something like this that you see on your screen. Now, this is a summary that any clinician support team, if they look into it, they get a brief gist of it. They don't have to go and look into what all interactions that have happened with the patients. So as you can see, you get a overall summary out there of what are the key issues that patients is having have been facing with, what are the medications that they're going through, what is the refill summary that is due for that particular patient, right? And to understand what is the week wise summary that you see in this section. Now, this is just a summary, but what if clinicians also or clinical support team want to understand the actions that need to be taken? And that's where the adoption increases, where you get to see that entire set of actions, right? Where in this case, if you see, there was an adverse drug event that have been reported by the patient because of some of the side effects. Now, that can be a possible escalation that can happen to the higher management, right? And that's where this team has to dig into, provide some support quickly. So that can be one of the next action that this member can take out. So that's one part of it, right? So this is one use case that's out there with multiple clients that we are working with. Switching to another use case that I just talked about, where uh, clinicians or the analyst have to dig into multiple level of information that is out there in database. And what we do is we allow an NLQ platform like this where you have a way to ask a question, and in the background there are multiple agents that get triggered in to give a summary, something like this, right? Now you have a three-part summary to it. You get the insights out of it. You get to see the actions. You also understand from where this information is coming from, the SQL query behind it, right? Now this becomes easier for a clinical analyst to do a deep dive on a particular, maybe it can be a prior authorization use case that clinical analyst is solving for. Now this talks about the structured information, right? If I'm trying to retrieve, what if you have your information lying out in multiple unstructured documents, and that is what happens where they have to start looking into the policies, some of the compliance documents, and then decipher all those clauses and all. Again, imagining where we give a platform like this where they have to just ask a natural language query, and then they get an insight, something like here, where if you can see example where I've tried to uh, ask what are the criteria of prescribing a drug called Humira. Now all that information is there out in some of the PA criterias of or for this specific drug, but the system has already given all that insight out, which will enable clinical analyst to take a decision on any pending prior authorization that person is dealing with. So all this solves the entire workflow. There's also a workflow that I want to talk about for the nurses team, right? I just uh, briefed on this as a use case before we went into a demo. Now, this is a system or a AI solution that takes all set of documents that are around your lab reports, that are around your medical, the vitals. So all that you need to do is basically upload that bunch of documents over in the system, and it can be around your ECG report, your echo reports, the reports on the medical, and then you trigger set of agents. Now these are the agents which run the background, something on ingesting the chart information, the parsing the note information that are out there, reconciling that entire medical information, all the activities that have happened with a patient being in hospital. It also does a check on the measures to create the discharge summary, right? Then is there any information on the follow up, and then finally the summary composer agent kicks in to summarize it in a way that you see on the right hand side as an output. So here is an output that it spits out as a discharge summary, right? Where you have different set of section, like what is the reason that the patient got hospitalized, what are the discharge diagnosis that went in through, course of actions that were taken, the problem list. One of the key things also to note here is we provide the citation out there so that the information that is coming out in a summary is already grounded enough to the documents that you have shared, right? Then you have the discharge condition, the allergies, the patient lab information, the medications that were given at that are given at the discharge, the follow-ups that are pending, all the family instruction or the patient instructions that go out, right? So all this is the information that nurses were writing manually when a discharge case happens. But now with the help of AI and agentic AI, we are just reducing that entire time to build this out. So that's one use case. There's also a use case that I discussed on the MLR side of the things, right? Where any promotional activities or any promotional uh, uh, output or the promotional campaigns that any marketing team of a pharma client has to deliver has to be vetted through with different business units, and that's what this agent does. So you upload all the excerpts, all the ad campaigns that you want to run through, uh, trigger all the set of agents, and the moment all these agents run, you get information out there to tell you, okay, what are the compliance flags that you have to look into your promotional detail or the draft that you've created. As you can see on your screen, it has just spit out one of the claim that is not as per the guidance that is being set. You also have a way to see what exactly is wrong with that campaign that has been run or the marketing input that has been given out, right? And then you have a way to synthesize all that information, look into a way that whether this is ready for the submission or not. Right now, it's flagging it as moderate, so you obviously have to go back and see and resolve this claim that has been done in that document. So as you can see, right, I have demonstrated multiple such use cases which streamline the entire process of different workflows. Now, how is this done at scale for our clients? So we have been working on these use cases quite a long time now, and that's where we have created all such accelerators. Let me just pull that slide for you. Right. So all these accelerators that we have developed over the period helps us to fast track any of these workflows for any of our new clients. Right. You have co-pilots out there which can scaffold the entire agentic use case. You have connector library more than 15 plus, which can connect to your EHRs, your PBMs, something like Epic, Cerner's, and Meditech. You also have an adoption playbook that we have developed over the period that help us run through for our new clients. Then you have a governance kit that can help mitigate some of the risk that may flow in adhering to all the governance policies that are out there, like HIPAA and all. Now, together, all these escalators have ensured that adoption is around 3 to 5 times faster, and parallelly ensuring that it's well compliant enough, they are measurable, and they are production ready. Now, for the next slide, I just wanted to bring up what are some of the reliability and observability framework that we are building out, right? Because we often get a question from the leaders that can these agents be trusted in production or not? Will they deliver the right ROI or not, right? And that's where our reliability and observability framework and set of tools that we have designed help answering them. And these are nothing but some of the SLOs that you have set up, which let's say for intake assistance, we have a SLO that it has to respond in within 2 seconds. So that way you have a way to track the behavior of the agent. We do some of the tracing as well, right? Now these are the tracing that are done as per the HIPAA and the other governance frameworks being out there. So that tracing is already there. That entire transparency of how actions that are taken by the agents is all tracked. There are also safety nets that we have created. So let's say there are 2 to 3 processes or the task that agent has to do. Now, if an agent goes out of these 4 steps and then runs into a loop, we have a safety net so that that entire process can be directed back to human for a review. Human just gets an alert, jumps into it and fixes it, right? So that's a safety net that we have put in place. We also have drift alerts. Now these are the drift alerts for your schema changes that can happen in your EHR system just before any workflows breaks, right? Now, how do you ensure that reliability is taken care, but also there is a safety for the solutions that we build in? Now that goes through all the development efforts that we do it, right? When we are developing these solutions, we ensures that there is an offline testing being done on the golden data sets that we have. Again, considering picking up the same example of intake notes, we have leveraged all the golden data sets for our clients on how the nurses build notes manually. We validate that against the notes that gets generated by the agents, LLM agents, and same goes for the denial letters that have been sent out. While we put it in production, while we put all the solution in production, we also run a shadow mode. What we do is we run all these AI solutions with the clinicians doing the live testing, right? And also while we do a full rollout, there are already audit trails and monitoring that's been taken care. Again, as I mentioned in the previous slide, there is often a question that we get to ask is around ROI, right? Because you have to answer that to your leadership team. Now, this slide just summarizes that to you. And this is a measurable impact that we have seen across our clients, where we have seen that around 20 to 40% reduction in the clinician admin time. There is a drastic change around 50 to 30%, where we see fewer error claims on the claim side, 15 to 25% efficiency in the workflow. There is a CSAT of the patient that has improved from 10 to 20%. Your research cycles have been faster from 1.5x to 2x. And then the compliance is incident, right? These are the incidents that you get from your audit team. That there is a drastic reduction of those compliance incidents from 40 to 60%. Now, what sets Factspan aside or uniquely positioned into the space of entire healthcare or running agentic AI for healthcare workflows, right? And I've talked a lot on the accelerators that we bring into the table. The gap that we have seen with enterprise clients is around integrations getting piled up. The governance is not mapped rightly. You do not have a way to get the pilots to your scale. And that's where Factspan bridges that entire gap with the connectors, the compliance kits, the ROI framework, the accelerators that we bring to the table. All that is done on the foundation that AWS provide, the bedrock agents that we work with, the guardrails, the health AI toolkits. So that's the bridging that Factspan does, working closely with AWS and with the partners that we onboard. And just to advocate that, I'll also request Jonathan. I mean, you have worked closely with multiple such partners, right, in the space of healthcare. In your opinion, what do you think? As a partner, Factspan is something different that we bring into table. I would like you to hear your point of view as well on that.
Yeah, for sure. So AWS does provide comprehensive infrastructure and services that enable healthcare organizations to drive these digital transformations. And a lot of the partners, such as Factspan, just bring additional value by offering these specialized tools on top of AWS' robust foundation and extend a lot of the capabilities. So these healthcare solutions do complement AWS services, and Factspan is already leading the way in certain aspects, and they've already started pursuing things like Agent Core that's been released relatively recently. So we've seen various different integrations that kind of work through the partnership between partners such as Factspan and AWS services, and we've seen clients achieve strong results through this combination, leveraging both the core capabilities and the extended solutions to accelerate their transformative journey.
Thanks, Jonathan. Thanks for advocating that for our audience, right? Now, the natural question is, how do we take this from day one? What does the roadmap looks like? By when our clients can see the value, right? So this is a typical 90-day path to value that we have together jotted down with AWS, right? So for the first 2 weeks, we run rigorous discovery workshops. We spin up the AWS sandboxes. We work closely with AWS team to enable some of the credits that our clients may require. And all our accelerators and the toolkit, the co-pilots are already there in the AWS marketplace. So any of you can just plug and play into the AWS sandbox for you to test out on your data sets. The week 3 to week 6 is where the pilots go live with all the guardrails that we have. The 7 to 12 is where we do a rollout to enterprise with all the dashboards, the governance kits, the change managers, which is very important, right? So all this path to roadmap, if followed, and we work with our clients to follow this, we see a 3x to 5x faster adoption. There's already 30 to 40% reduction in the time saved across all the workflows that we deploy with our clients. So as we have seen in this entire webinar, right? So I've tried to showcase the key co-pilots that we have seen success for our different clients. We have seen what are the guardrails, what are the agentic frameworks that we should be leveraging in. I believe that might have given a good context on how to leverage agentic AI in the space of healthcare. I can understand if this might have for sure resonated with some of the challenges that you are seeing in your space as well. And for that, I would basically happy to answer and open the forum for questions that you may have. That can be around the technology, it can be on the compliance side of the things, anything on the adoption side of things that you may be facing a challenge in your systems. Me and Jonathan are happy to answer all those to take you to the next stage. And those questions can be anything, right? I mean, and some of the questions that we hear a lot is where should we even start, how do we pick the right first use case, what is the low hanging fruit out there. These are some of the common questions that we hear, and my answer have been easier, like let me start small, pick up a high value workflow, right? One of it is intake process or the claim denial process. Scale it in 90 days, and then we work together to accelerate that entire journey of putting many other co-pilots into the system. I'll just look into chat if we have any questions out there. Just stop sharing as well. Right. Let me just pick up. All right. So I think we have one question out there. I just want to repeat that for our audience here. How do you ensure explainability and auditability for regulators? Now, that's a right question, right? I think and that's where many of our clients also wants to understand, because this entire space needs to be compliant enough. So as I talked, we have multiple such frameworks around observability. We keep a track of every decision that agent is taking. There are set of dashboards and monitoring engine that we have developed for us to keep a track of that. And while we put LLM into production, we have done thorough testing on multiple evals, multiple golden data sets that allows us to ensure there is right amount of explainability and observability. And also it also boils down to the level of UI design that you're doing, right? I mean, you might have seen some of the examples in the UI screens that we showed. You get to see that citation on why that has been flagged or that has been summarized in a way that it should be, right? So that allows the business team to take a decision. Okay, this is what is being summarized because of X and X input that has been given, right? We have also seen in our NLQ platform where you get to see the table information, the actual citation from the document that it is being referred. So that all level of explainability goes in the way you design your UX. And over the period while working with our clients, we have learned that we have been into that path. And for any of our clients who work with us, you get that acceleration from the day one, right? You don't have to reinvent that entire cycle of developing from the scratch. We bring all along with us while we onboard. So that would have answered some of the questions. Jonathan, you have anything to add from the AWS side of the things? I think you talked a lot on the observability services, but feel free to share your thoughts as well on that.
Yeah, in terms of the infrastructure, AWS is compliant with multiple different regulations, and you're able to actually see a list of them on the website. If any of you do want it, feel free to email me afterwards, and I can just send it over, or you could just search on it online. And if you actually through the AWS console, if you want to ask a little bit more about the actual infrastructure, various different auditory reports and compliances can be found for free through AWS Artifact. So that also resource is there. You can be rest assured that security and compliance is at the top of the priority list for AWS, and I'm sure it's also the case for Factspan.
Yeah. I think we have another question, and just I can just speak that aloud. The question is around how difficult is it to integrate with Epic, Cerner, or any of the other systems out there. Yeah, I think that's again one of the key questions that we get to ask, right? And I've also tried to connect that in my slides as well. So so integration is obviously a bottleneck, and we have seen that being working. So what we have done is we have created multiple such connectors. We work closely with Cerner as well in some of our clients ecosystem. We closely work with that team to integrate our AI solution in the UI that they provide. For some of the open source or any of the other systems like PBM, we expose our services and APIs. We use the REST APIs to consume some of the APIs that they offer, and that's where the integration happens much more easier way. And someone do not have to worry about those connectors out there, right? We already have some around 10 to 15 connectors integrating with these systems out. So I think we can take some more questions out as well. Feel free to drop in those. Any thoughts? Uh, Anything that's coming in the mind? Happy to take those questions again. We'll just allow one more minute, and then we can conclude this webinar. Never mind. So, if there are any questions that come along in your mind after this webinar, feel free to drop in to our email IDs. You can directly reach out to Jonathan or me in the email that you have just listed out. You can also look out for some of the collaterals that are out there in our website, our social media channel, and also on the AWS marketplace. All these accelerators are out there listed, vetted through by AWS team. Feel free to drop in the messages out there as well. I believe this would have helped, and appreciate everyone's time. And I can understand it is valuable as well for you. So thanks again for joining in. We look forward for any of the questions that you may have. Happy to address them. I can quickly jump on to a one-on-one demo as well, basis the questions that we get in.
Thank you very much.
Thanks again for joining in. Have a great day.